Okay, this is the frontal vision. The bones taking part in the frontal portion is the frontal bone, maxilla bone that forms the cheek prominence. This is the zygomatic bone. Mandible, if it was present, it's not present over here. And we have the nasal bones. Okay, we study the frontal vision into 4 different headings. First of all, we are going to study the frontal portion. This point, these are known as superciliary arches. The point where these two superciliary arches that are more prominent in males, they meet together. This is known as glabella. Then this is known as the internasal suture, and this is known as frontonasal suture. The point where the frontonasal suture meets with the internasal suture, this is known as nasion, and the lowermost point of the internasal suture, this point, it is known as rhinion. And this is known as the frontal eminence or frontal tuber, which are more prominent in females and children. Then we have this nasal area. This is the piriform shaped bony cavity of the nose. Its upper margin, it is formed by the lower border of the nasal bones, and the lower margin, it is formed by the nasal notch of the body of the maxilla. This is known as the anterior nasal spine over here, anterior nasal spine, and this is known as rhinion. Then we'll talk about the bone maxilla. This is the frontal process of the maxilla. This is known as the zygomatic process of the maxilla, and this is known as the alveolar process of the maxilla, which bears the sockets for the teeth. Zygomatic के लिए okay, this is the frontal portion of the zygomatic, and the suture between both of them, it is known as frontozygomatic suture over here, frontozygomatic, and the suture over here, which is faintly observed, this is known as zygomatico-maxillary suture between the maxilla and zygomatic. Then we have a foramen on the surface of the zygomatic bone. This foramen, it is known as the zygomatic foramen, which transmits the this is known as zygomatico-facial foramen, zygomatico-facial foramen. Under ki taraf, this we have another foramen. There is no light over here. So this foramen, it is known as zygomatic foramen. This foramen inside this foramen, this is known as zygomatic foramen that transmits the zygomatic nerve. This is known as zygomatico-fascial foramen. Zygomatic nerve will divide into 2 parts, zygomatico-fascial foramen जो यहाँ से निकल जाएगी, and then zygomatico-temporal foramen जो यहाँ से निकल जाएगी, zygomatico-temporal nerve. So basically we have 3 foramens on the zygomatic bone. This is the zygomatic foramen which will transmit the zygomatic nerve. It will divide into 2 parts, zygomatico-facial nerve which will come from the zygomatico-facial foramen, and zygomatico-temporal nerve which will come from the zygomatico-temporal foramen inside this. Okay.